Hi everyone, today we will discuss about all important questions of blood transfusion procedure. What is the most important nursing action before starting a blood transfusion? Option A, check patient pulse. Option B, take consent. Option C, verify patient identity and blood group. Option D, warm the blood bag. Option C is the correct answer. Verify patient identity and blood group. Next, how soon should a nurse start a transfusion after obtaining the blood from the blood bank? Within 1 hour, within 50 minutes, immediately. Next, within 30 minutes. We can start the blood within the 30 minutes. Option D is the correct answer. Next, what size of the cannula ideally for blood transfusion in adults? 18 gauge cannula we are using mainly. 22 gauge no, 24 gauge no, 26 gauge no. Which IV fluid is compatible with blood transfusion? 5% dextrose, 5% dextrose no, single lactate no, it's used for only the burns patients. Dextrose saline no, we are mainly use the normal saline. Option B is the correct answer. Next, which sign indicates a hemolytic transfusion reaction? Option A, hypertension. Option B, bradycardia. Option C, back pain and hematuria. Option D, constipation. Option C is the correct answer. Back pain and hematuria. Option C is the correct answer. Next, during a blood transfusion, how often should vital sign be monitored in the first 15 minutes? Every 5 minutes. Option B, every 15 minutes. Every 30 minutes at the end of the transfusion. In every 15 minutes, every 15 minutes we are dividing by 3, 5, 5 and 5. We have to check every 5 minutes. Within the 15 minutes, 3 times we have to check. So answer will be every 5 minutes. What should the nurse do if the patient develops chills, fever and chest pain during transfusion? Call the doctor. Call the doctor no. Slow the transfusion no. Stop the transfusion immediately yes. When it's happened suddenly, any allergy or any reaction will happen, then at first we have to stop the transfusion immediately. Give the paracetamol no. Next, what is the maximum time allowed for completing a unit of blood transfusion? Option A, 2 hours. Option B, 3 hours. Option C, 4 hours. Option D, 5 hours. Option C is the correct answer, 4 hours. Option C. Next, why is a filter used during blood transfusion? To regulate speed, to prevent air embolism, to remove clots and debris. Option C is the correct answer, to remove clots and debris to prevent infection no. Next, which blood component is given for a patient with low platelet count? Whole blood cell, fresh frozen plasma. Option C, platelet concentrate. Option D, packed red cells. Option C is the correct answer, platelet concentrate. Next, a febrile non-hemolytic transfusion reaction is most commonly caused by hemolysis. Option B, leukocytes, antibodies. Option C, AB-OS mismatch. Option D, platelet antibodies. Option B is the correct answer, leukocytes, antibodies. Leukocytes, antibodies. Leukocytes, antibodies. Option B is the correct answer. Next, which of the following is a delay complication of blood transfusion? Anaphylaxis. Option B, hemolytic reaction. Option C, graft versus host disease. Option D, fever. Option C is the correct answer. Option C, graft versus host disease. Next, before transfusion, the nurse must check the blood bag for expiry date, hemolysis, leaks and clots, and Option D is all of the above. All of the above we have to check before the blood transfusion. Expiry date we have to check, hemolysis we have to check, leaks and clots we have to check. So answer will be option D. Next, transfusion of cold blood can cause tachycardia, hypothermia, hypertension. Option D, hyperkalemia. Hypothermia means decrease the temperature of the body. Hypothermia means increase the temperature of the body. So answer will be option B. Tachycardia no, hypertension no, hyperkalemia no. Next, what should be done first when a transfusion reaction is suspected? As we already discussed before, we have to stop the transfusion first. Option B is the correct answer. Stop the transfusion first, then inform the physician. How is blood type compatibility determined before transfusion? X-ray, Coombs test, option C cross matching, option D CBC. Option C is the correct answer, cross matching. Before the blood transfusion we have to do the cross matching. Next, what is the purpose of the Coombs test in transfusion? Detect viral infection. Option B, detect antibodies against RBCs. Option C, measure hemoglobin. Option D, determine WBC count. Option B is the correct answer, detect antibodies against RBCs. Next, anaphylactic reaction is the most common in diabetic patients. Option B, patients with IgA deficiency. Option C, pregnant women. Option D, cancer patient. Option B is the correct answer, patient with IgA deficiency. Option B is the correct answer. Next, what is the proper storage temperature for blood? 0 to 2 degrees centigrade. Option B, 4 to 6 degrees centigrade. Option C, 8 to 10 degrees centigrade. Option D, 10 to 12 degrees centigrade. Here answer will be 4 to 6 degrees centigrade. 4 to 6 degrees centigrade, but in some of books here 2 to 6 degrees centigrade also the correct answer. Next, the universal recipient blood group is AB positive. AB positive is the universal recipient and universal donor is O negative. A nurse must start transfusion slowly in first 15 minutes. 15 minutes we have to start slow, then normal. Which transfusion reaction is characterized by the urticaria and itching? Hemolytic, allergic. Option B, allergic. And option C, anaphylactic. Option D, febrile. Option B, allergic is the right answer. Option B is the correct answer. Next, which blood group is a universal donor? Universal donor means who can donate to every blood group. O negative, A, B, even AB and O negative. O negative is the correct answer. Option D is the correct answer. O negative who can donate to every blood group. Next, blood transfusion should never be mixed with normal saline. Option B, Ringer's lactate. Option C, heparin. Option D, sterile water. Option B is the correct answer, Ringer lactate. We have never be mixed with the Ringer lactate. Next, RL. Next, blood administration set should be changed after 1 unit. Option B, 2 units or 4 hours, every hours. Option D, every 15 minutes. Answer will be option B, 2 units or 4 hours. Option B is the correct answer. Next, the most common cause of transfusion related death is hemolysis. Option B, anaphylaxis. Option C, trial transfusion related acute lungs injury. Option D, hepatitis B. Option B, C is the correct answer, trial transfusion related acute lung injury. Next, what is checked in post transfusion monitoring? Option A, vitals. Option B, urine output. Option C, patient reaction. Option D, all of the above. Option D is the correct answer. All of the above. Next, blood must not be warmed unless patient is cold. Option B, doctor orders. Option C, rapid transfusion of large volume is needed. Option D, it's raining. Option C is the correct answer. Rapid transfusion of large volume is needed. Next, for a massive transfusion, which electrolyte imbalance is most likely? Option A, hypernatremia. Option B, hypokalemia. Option C, hyperkalemia. Option D, hypercalcemia. Option C is the correct answer. Hyperkalemia. Option C is the correct answer. Hyperkalemia. What must be documented after blood transfusion? Time started and ended, we have to check. Okay, then B, any reaction occurs or not. Option C, vital signs. Okay, then all of the above. The answer will be option D, all of the above. Next, thank you everyone.